Hello, Doc.
Hello, Doc.
Make a date with our health professionals on the drive with the area gang. Hello, Doc. Hello, Doc.
Hello, Doc.
Good afternoon, Doc. You're welcome.
Thank you. Good afternoon.
I know it was hectic getting here this afternoon. Today we want to look at menopause. For the sake of time, we're just going to jump right into the conversation. So exactly what is menopause when we talk about menopause, and then if you'd also give us the age range between that.
Yes.
Yeah.
So menopause is a term to mark the end of a woman's reproductive years. So if the woman has stopped having her menses for 12 consecutive months with no menses, yes, then that is what we call menopause. And it usually occurs between age 45 to 55. So the average is 51 years old.
Okay.
Yeah, but it can come early or later. If it's maybe from age 40 to 45, then we say it's early menopause. But if it's less than 40 years, then that's a premature menopause.
So what exactly is going on in a woman's system when her periods become irregular or it's unpredictable? I know you've mentioned that menopause is when continuously for 12 months, that is a year, a woman does not see her menses. Yes. But what are some of, what exactly is going on? What are some of the changes that are going on?
That's what we call perimenopause. So that's actually the season people call menopause, but that's not actually menopause. That's perimenopause. It's the transition period towards menopause. Some people take about a number of years, from up to 4 years to even 8 years during that perimenopause period. And in that time, there is a fluctuation in the production of estrogen and progesterone. So that's the female hormones. Yes, so there's a lot of fluctuations. Sometimes it's produced, sometimes it's not produced.
So that is why the menses becomes irregular.
Yes, so it affects other hormones too, which also are supposed to trigger the ovulation, which also don't. And then it's irregular that way. And so they would either have maybe heavier menses or lighter menses, or
it doesn't come at all.
Yes, so they'll skip a few months, then it will come again and all that. Okay.
Usually when we talk menopause, one thing that people usually mention is hot flashes. What exactly is hot flashes and how severe can they be?
Okay, yes. So hot flashes is a sudden feeling of intense heat. Usually in the upper part, so the face, the neck, the chest area is usually what they complain most of. And it affects, let's say, 75% of women going through the perimenopause.
Okay.
Yes, so it's quite common, but the severity, it varies with different individuals. Some people, it's associated with sweating, palpitations, anxiety. Sometimes they even have chills immediately after the hot flashes and all that. But it's because estrogen is supposed to control a part of the brain that is regulating the body temperature. So once there is a fluctuation, then it affects the way the person feels body temperature. So you feel that the room is very cold, but then they are still feeling very hot.
Yeah.
Yes. So that's the hot flashes that occurs.
Let's also talk about some emotional changes that occur during menopause.
Yes. So estrogen too is associated with certain hormones, serotonin, norepinephrine. Those are hormones that regulate mood in the brain.
In the brain, yeah.
Yes, and activity levels in the brain. So usually they will have mood swings, easily irritable. They get very angry very easily. They can be anxious, they can get depressed, and then sometimes they have difficulty in concentrating, they can't focus, or they have poor memory or memory lapses, or something we call brain fog. But this also coincides with other things. So sometimes it coincides with changes in their family dynamic. Sometimes the children
when they
are going
lose somebody or the children are going away.
Yes, those kind of. So it's should I say, it meets with all those other social things, and then those can actually aggravate
the problem,
the emotional states. Yeah.
Okay. Speaking of the emotional state, I know that when we talk about intimacy, definitely emotions also play a huge role. So when it comes to menopause and intimacy and sexual health, how does that also come into play? How does the menopause affect the intimacy and also the sexual health?
So there is what we call genitourinary syndrome, which is caused by the lowering or the absence of estrogen. Okay. So estrogen actually plays a part in the should I say the womb down to the vagina. So when there's a lack of estrogen, then the cells there become thinner, they dry up. So there's a lot of dryness, there's a loss of elasticity. So it makes intercourse very painful
for them.
Yes, and it also changes the pH of the area.
Of the vagina, okay.
Yes, and then it leads to susceptibility to more infections. Yes, so that's part of the reason why a lot of times they will lose interest in intercourse. But aside that, to the other sex hormones also, the reduction also reduces the libido, the sexual desire anyway. It's also part of it as well. So the combination of those two things, and as well as the emotional states, can also affect the
intimacy. But is it only on the downside though? Because I've heard people say that sometimes when women get to menopause, they become very hypersexual. I've heard something like that. I don't know if it's true.
I don't know. I would have to look into it. What I have seen mostly, and what from my side, maybe especially a gynecologist would be a better person. Yeah, but I only see the downside.
The downside of it. Okay. Let's also look at how menopause can be treated medically. Is it something that you can slow when it starts, or when it starts, it just has to, nature just has to take its course?
Yes. So if you are having a premature menopause, an ovarian failure, or something medically going wrong, yes, there are some treatments that can help. But if it is the normal natural process of menopause, and you are not maybe trying to get pregnant later in that period, we don't really do anything.
You just manage the symptoms.
Yes, we just manage the symptoms. You don't really, menopause is not a sickness, you don't treat. But maybe if they are having negative side effect, or the symptoms are too severe, like the hot flashes are too severe and unbearable, they are not able to sleep and those kind of things, or they are having a lot of infections, the dryness and all that. So, but normally we just advise lifestyle changes, exercise, healthy diets.
It looks like that's like the magic how do I put it, magic solution for a lot of things.
It sounds so simple, but it's quite difficult to do. Healthy diets, reducing stress, stopping alcohol and stopping smoking and all those things. Sometimes we might treat the moods and all those things with some antidepressants and other things,
mood regulators and all that.
So the hormonal therapies, we have the estrogen creams that we apply locally to the genital area, so that it's causes the elasticity and then the pH to normalize around that area. And then the hormone replacement therapy is only for people who have severe symptoms, and it should be monitored closely, because the hormone replacement therapy, there are also a lot of risks associated with taking exogenous, like estrogen from outside the body. Yes, there are a lot of risks associated. So you have to see a doctor, and then they should personalize the dosage according to each individual.
So when a woman hits menopause, are there some other bigger health challenges that women should be concerned about? You know that, okay, once I've hit menopause, then now I should start thinking about this or that.
So estrogen has been protecting women from a lot of diseases. Okay, so that's why part of the reason why men die earlier than women and all that.
Oh, really? I didn't know that.
So once the estrogen is gone, then there is accelerated bone loss. Okay, so it actually helps to keep the bone strong. So once it's lost, then you have what we call osteoporosis. The bone density goes down, and then they easily get fractured. So you hear an old lady, she was just walking and she had
and then
her hip is broken.
And then usually that's why most old ladies, they seem bent. Should I say it like that? Yes.
So that's one very common issue with the older ladies. Then cardiovascular diseases, heart attack, stroke, they're also at a higher risk. The estrogen actually helps with cholesterol metabolism, and it helps keep the blood vessels stronger and all that. So once it's gone, they're at a higher risk of developing these diseases. Sometimes too, it also affects insulin resistance. Yes, so then they can develop diabetes in this period of time as well. And then there's also a mechanism that changes the way fat is stored. So now they will gain more weight, even though they keep the diet the same.
So at that point, what can they do to sort of protect themselves from all these things?
Yes, so you just have to try and be healthy. So at first, maybe you weren't living a very healthy life, but your estrogen was protecting you.
Okay.
But now that the estrogen is gone, you have to now
put in extra effort.
Yes, take your diet more seriously. Be more conscious about exercising, because usually that's around retirement time, and then they are just at home not doing much.
You're sedentary, you're not doing much.
You can take supplements like those vitamin D, calcium supplements. Usually those like they have these supplements for women. For women, yes, it's mostly probably some fish oils and then the calcium, vitamin D supplements, and it really helps to prevent the osteoporosis.
Okay, and then finally, we want to look at support systems. How would you, if you have a relative or a partner, a friend who is going through this menopause, how can you help them through the process? How can you help make life easier for them?
Yes, so don't stigmatize them. A lot of people will say you are exaggerating and all those. It's a real problem. They are actually
I do that to my mom sometimes. Hey, also dear, baby, how far is serious?
Yes, but it's actually something that is really serious, especially the perimenopause, when some people have very extreme symptoms. Yes, so don't think that they are over exaggerating. Try and educate yourself, learn about these things, be patient and understanding, listen to them when they are making their complaints, okay, and then offer practical support. So maintain a cool environment. Maybe you don't like the AC on, but because of her,
you have to compromise.
Let the AC be on so that she can also be a bit comfortable, be a bit flexible, and with your plans and all those things, and then encourage them to see a doctor when they need it, or at least just to do the normal screenings and checkups, check their cholesterol levels, their kidney function, and those
liver and all those things.
Yes, and also encourage them to also take care of themselves, encourage them to eat well, exercise. If they are drinking a lot, just encourage them to stop. And all that. Yes, and you have to respect that every individual is different. Don't say, hey, this auntie, she didn't experience anything, you alone, look at what
you're always complaining.
So each individual is different, so you have to recognize that everybody goes through it differently, and then understand everybody at where they are at their points in time.
Okay, all right, thank you so much, Doc, this afternoon for giving us that education on menopause. Definitely we'll meet next week.